I met Foster probably when I was young, but really didn't get to know him until I returned to practice law in Athens with my father's firm. I got to know Foster because he was in the upstairs of our office building and I was in the downstairs, and occasionally he used to summon me up to his office. But we became really good friends. As he was aging, he made a plan. He met a lady named Zelda, and they talked, and Foster and I talked, and it ended up with Foster made a plan for charitable giving, to give away most of his wealth to a variety of charities.
Well, it started in actually December of 2019 when we first heard about the coronavirus in China. But we had our first cases here in January. We had very little disease in Athens County through the summer months of 2020. But by September, we had a lot of disease.
When COVID hit, initially the school closed down and we were worried about the children who attended the Hive, what they would be eating because they relied on their school lunches. And I was already part of the Thursday night community dinner, and so I just decided to expand that operation a little bit. We decided, since it was no longer safe to meet in person, we would deliver the meals to our families to let them know that we still care about them.
Well, when I think back about the last 2 years and some of the things that we're most proud of, it really was lifting up local community small businesses. We had participated with the SBA's Paycheck Protection Program, which was a loan program geared to get money quickly into small business owners' hands so that they could keep their doors open for business and pay their employees. It took a lot of work, but it was really, really worth it, and we knew how important those monies were.
So when the pandemic hit in spring of 2020, the Osteopathic Heritage Foundation of Nelsonville really wanted to launch into action quickly. And really we're here to look at how can we play a part and how can we partner with others.
The community was in severe shortage of PPE, so I really wanted to contribute my share, my kind of membership to this community. So I wanted to stand up and help at a time in need. We realized how small our network and power is. We wanted to kind of motivate more community members to join us, to have more donation to help the community.
And so we started having volunteers from the community, from all over the community. And we did that for probably the first year and a half. And then the COVID numbers started spiking up, and we decided it wasn't safe for our volunteers to deliver, so we did take a couple months off. But we did have emergency food supplies for people, and they could drop by our office. We had a freezer and a fridge, and we were giving out food every single day. And that's when our free table started.
We got our first vaccine in December of 2020. We delivered vaccine to about 1,100 people that first day. And from then on, we had a number of mass vax clinics. We were helped by not only the medical students, but the student nurses. Ohio Health supplied us with nurses and some other supplies. And so this collaboration between the Heritage College of Osteopathic Medicine, the health department, and Ohio Health was really ideal. I think the pandemic brought us closer together.
So one of the things we do with the Cornwell Award is we remember. We remember Athenians who have done significant things, had significant accomplishments, especially in service of their community.
What I know for sure these last 2 years, it was more amazing than I ever dreamed it could be possible. Just how people care about each other, how we care about each other's business, how we came together and talked through challenges in a way that certainly superseded banking.
So I think that the power of the Response Fund has been in the generosity of many folks coming together wanting to make a difference and helping their neighbors right now, and being able to see that that can be bigger when it's all of us together.
I would like to say how really grateful I am to the staff at the health department and to the university. But I'm really grateful to the staff at my own. They've been determined, they've been indefatigable, they've been remarkable, they've been strong. I don't think words can describe how grateful I am to them.
I don't know what could be more important than building a stronger community, because if our community's stronger, we're all better.